Kegels aren't good for everyone.
Why?
If you have a really tight pelvic floor and if you get Kegel happy, you can actually create what we call is a hypertonic pelvic floor. And now those muscles are constantly on and in spasm, and you can make things much worse.
Welcome to GlowLab. We're gonna have a lot of fun and learn a lot together. Today's topic is so important, especially if you are a woman. Whether you want to have kids or not have kids, this topic is for you. It is all about our pelvic floor. My guest is Dr. Luly Diez-Arguelles. She is a doctor of physical therapy, but she focuses on the pelvic floor. She's a pelvic floor therapist. And everything she said made me realize how much I have ignored this area of my body, and I've been doing myself a disservice. So please watch this episode, listen to it, share it with your friends because it is so insightful. All right, this topic I feel like is one of the most important topics for women who, especially when they have babies.
Yeah.
And I feel like even as a mom of two kids, I don't really know enough about my pelvic floor.
I think it's true. Nobody really knows what it is. We hear it a lot. And I always joke around that people know how to work their phones better than their pelvic floors and their vaginas.
Yeah.
If that's okay to say.
Yeah, of course it is. Yes, of course it is. 'Cause it actually plays a part, right?
Yeah, huge part. And there's just a disconnect more so after we have babies, because that becomes a place where the babies came from, or if you have a C-section or something like that, we see a huge disconnect between like our pelvic floor and the rest of our bodies.
Okay, well, first tell us a little bit about your background and how you found yourself in this field, this therapy.
I always have been into exercise and fitness and stuff like that. So when I'm trying to figure out what I want to be when I grow up, a physical therapist just seemed like the right fit. But I wanted to do sports or something like that. And my oldest son was born while I was in physical therapy school. And I had a wonderful pregnancy, but I had one of those traumatic deliveries that just traumatize people and they don't want to have kids after they hear the story. That's what happened to me. And 18 years ago, when I was trying to heal from his birth, there was nobody out there to help me. I couldn't find doctors, I couldn't find therapists. And when I would go see people, they'd be like, well, you had a baby, and I was not okay with that. I was in school and I had a lot of great friends. So I did research and, one thing led to the other, and this is my life now.
I am actually shocked because I've heard from friends that live like in France, for instance, that going to a pelvic therapist is part of their prenatal and postnatal care. And it blows my mind that that's not something that we take into account here. And I remember actually after I think my second child, I decided to try to look for somebody and it was not easy. I didn't find anybody and then I gave up.
Yeah. Oh, I'm sorry that you gave up.
I know. I gave up because I have diastasis recti. We were talking about this a little off camera, and I didn't realize your pelvic floor plays a part in that too.
A huge part. I mean, we just don't realize, like I said, what it is. Since it's not a body part we can see, it's harder to connect. Like if we tell you, do a bicep curl, we can show you exactly what that looks like. But when we have someone to engage their pelvic floor, either to relax it or to tighten it, it's so abstract that it's much harder to teach unless you have this like one-on-one connection, I think.
Okay, so then tell me, what is the pelvic floor?
The pelvic floor? Yeah. So our pelvic floor is really the foundation to your core. When I say core, what do you think of?
I think my tummy, my thigh, like my muscles, like the muscles kind of in this area.
Yeah. So your core actually is this part around your body. So it is your abdominal muscles, your back muscles, your pelvic floor muscles, and your diaphragm. That's really your core. But when people hear core, they think crunches, and that's about it, right? So if you're only doing crunches, you're just strengthening the front side of your core and all the rest of it kind of gets neglected. So our pelvic floor is the foundation under which our core is built. It's a group of 13 muscles that sit like a hammock in between your legs. Right? So it sits there and it kind of connects your pubic bone to your tailbone. And then it sits from like your sit bone to your sit bone, and it sits like that.
What are Kegels?
So Kegels are a contraction of the whole group of pelvic floor muscles.
Oh, so your pelvic, so when you're doing Kegels,
you're contracting your pelvic floor muscles.
Interesting. Yeah. Okay. It's all making sense to me. See, I'm one of those people that like, since I was a teenager and like reading magazines, I'd be like, I work my Kegels.
Yeah. And you're like, I don't know what I'm doing.
but I don't know. But I guess I never really put together. It's my entire pelvic floor.
It's the entire, bottom of your pelvis.
Okay. So tell us why the pelvic floor muscles are so important. So what are they connected to?
Like I said, it's the foundation of your core. Right. So if you have a weak pelvic floor, you're going to bottom out with any kind of exercise. So they provide the stability from the bottom of your body to be able to do everything that you need to do. So picking up your kids, if you cough or sneeze, they support that weight that's being pushed down onto your body. They also protect your back. They hold in the organs that live in the bottom of your pelvis. So that's very important. We want those to stay where they belong. And they're also really important for sexual function. So if we have weak pelvic floor muscles, our sex life can be a little lacking.
In what way?
So an orgasm essentially is your pelvic floor muscles contracting until spasm. So if your pelvic floor muscles don't provide good, strong contractions, your orgasms aren't as strong. Yeah.
Wait, I don't think I knew that.
Yeah, a lot of people don't. Yeah.
Oh, wait, is it a sign that I have a weak pelvic floor if I jump on a trampoline and I pee a little?
100%. It could be that they're weak and tight. Without doing a full pelvic floor exam, we wouldn't really know. But typically, yes, if you can't jump on a trampoline, that's a sign of pelvic floor dysfunction.
I can jump on a trampoline, but I might pee a little.
Yeah. Most of us do, because we've kind of just accepted these things to be normal as women, that we're like, oh, as I age, this will happen and I'll pee a little, so it's fine. Which is kind of sad that we've just resigned this, but we can definitely do stuff about it.
Okay.
And we can strengthen our pelvic floor. And as we age, we lose muscle mass, right? It's just one of those things, and we all know about it now. I think it's been a big topic of conversation with like menopause and aging. Like I think people are talking about it a lot now. And our pelvic floor is built up of muscles. So if we don't strengthen those as we age, our incontinence is just going to get worse, And then if our incontinence gets worse as we age, we're more likely to have like frequent UTIs and end up in diapers, and then you can get yeast infections and all these bigger complications. Actually, in nursing homes, one of the biggest problems is incontinence for people, because they get UTIs and then it gets them confused, and then it's just a disaster. So if we could just prevent that starting when we're younger, it would be amazing.
Well, okay, so I see a personal trainer as often as I can. So that's like 3-4 times a week sometimes. Mm-hmm. And we're doing a lot of core exercises. Yeah. Am I working my pelvic floor? Like if I'm doing squats, lunges, that kind of stuff, or am I not?
You might be if you have a good connection to your pelvic floor. The way our body is built, our pelvic floor muscles should turn on automatically when we do these exercises to support our body. But a lot of us have dysfunction, so it doesn't happen automatically.
So one of the things that I started doing as soon as I started having kids, like my first child, I remember looking at pictures and seeing this I was like, why do I stand like this? I would pick my child up. I still sometimes do it, but I'm more aware of it now. Pick my child up and I would put my belly up. Like almost like my bottom, I would like stick
like a shelf.
Yeah, like a shelf like that, so that I could hold my child. Yeah. And I would see it in pictures. Every time I'd take a picture of my child, I'd be like, sticking my gut out. Yeah. And I was like, why am I doing this? And then at some point, as I started traveling for work, especially, and being on airplanes, sitting all the time, I started noticing my lower back was starting to hurt a lot. So then I started seeing a personal trainer. She made me actually for a little while do Pilates. Yes. So that I could like private sessions, so that we could really focus on my tummy, because I have diastasis recti. But I still feel like there's this like disconnect where I can just tell
something's off. It's not fully healed. Yeah. Yeah. So the way I tell my patients this all the time, the way we hold our body really makes the biggest difference in how we're going to heal our pelvic floor or how we're going to heal our diastasis. Because you can do this amazing, amazing training session with your personal trainer for, you said 3 times a week or something, 3 times a week, 1 hour. But if for the rest of the time you're holding yourself like this, what you're doing is you're just putting all this constant pressure on your pelvic floor and also on your lower abdomen that's just going to be pulling apart that already weakened part of your body.
Yeah.
So one of the most important things we do is postural re-education. So we teach you how to stand in a way that your body is stacked, so you're not hanging on your ligaments, so you can hold your body up better.
Got it. And so that starts, because I think all of us go like this and we put our shoulders back, but we're not thinking about this lower part.
Right. And if you think about when you put your shoulders back, what happens to your rib cage? It flares out. So then that puts a stretch on your abs. So then your low back actually tightens up. So it could make your low back pain a little bit worse. So the cue I give for that mom posture is actually shift your hips back. And it's amazing in standing. If you're sitting, it's a little bit harder. But in standing, if you just shift your hips back like half an inch, everything lines up, and it feels weird initially, but then back pain gets resolved. Your muscles can work better because they're actually in proper alignment.
When should someone start seeing you? Like let's say pre-baby first, like people that have not ever been pregnant,
right?
When would they, why would they see you?
Yeah. So I like to think of myself like a dentist. Yeah. You don't go to the dentist just when there's an issue. I think all women should get their pelvic floor checked out. So if you're sexually active, if, anything like that, I think you should come see a pelvic floor therapist, because it would be good to know what's happening before there's any problem. Because I'll see people and I'm like, well, was this like this before? They're like, I never looked, I don't know. So it's hard to gauge what's dysfunction and what's your anatomy. Yeah.
How funny that we just ignore this area of our bodies. And it's such an important area of our bodies.
Yeah.
It's so
crazy.
strange.
Like, no. So if you can come, when you're sexually active, I think just to do an exam and see what's going on. And we talked about it. You're like, am I engaging my pelvic floor when I'm doing squats and stuff with my trainer? If we find out then that you're not, and we teach you before there's a dysfunction, you're set up for success. And it would probably be like, I'll see you once and then maybe I won't see you again until pregnancy, or if there's an issue later on. Right?
I see. So when you're doing a pelvic exam, is it kind of like going to see our OBGYN?
Yeah, it's very similar. We do an internal pelvic exam.
Okay.
Because we want to test the strength of the muscles on the inside of the body.
How are you doing that?
Our patients will undress from the waist down. We usually put like a little towel or a blanket just to preserve modesty. And then we wear gloves and we have you run through a series of different things. And first we just look externally to see what we see from the outside. So lower abdomen, even actually the space in between your legs to see what's happening. And then we'll insert a finger and we'll have you squeeze, we'll have you relax, we'll kind of poke around. I say poke, but feel the different muscles because there's 13 of them to make sure that they're all engaging properly. Another issue that we find a lot is people have really tight pelvic floors and they don't even notice. So, we hold tension in different parts of our body. So you might like be one of these people that holds tension in their shoulders or clench your jaw, but some people clench their pelvic floor.
Wait, how?
Yeah. So they might just be holding a Kegel all the time and they don't know it. So if this is you might have incontinence because your pelvic floor is so tight, it causes leaking. You might have pain with intercourse because if you think about like, if you tighten your bicep and poke it, it doesn't feel good, right? Versus relaxing your bicep and then poking it, it's okay. You can try to do it. And then same thing, if you're trying to have intercourse and you have really tight muscles, penetration can be really painful.
Yeah. By the way, you guys, as she's talking, I'm like over here like trying to see if I can like move any of my pelvic floor muscles. Yeah. I'm trying to be very aware of them right now.
So we run you through like all those tests, and depending on what we find, we give you feedback and come up with a plan to address whatever dysfunction. Okay. So that's kind of where it starts. And we always want to take our patients off the table, right? Because you don't live your life laying down. If we did, great. But we want to make sure that you're able to integrate those exercises with everything that you do in life.
Yeah, that makes sense. So how about a woman who's considering getting pregnant? Should she come see you if she's never seen a pelvic floor therapist before?
Yeah, I think they should, especially if you're...
Right before pregnancy? Or
So when you think you might want to start trying, I think would be a good time to come to see what's going on. The other thing that we look at is the position of the organs. Mm-hmm. So we feel where your uterus is, where your cervix is, where your vaginal canal is, and then the entrance to to your vagina. And we want, if you're trying to conceive, you want all those things to be in good alignment, right? Because you want it to be an easy path for the sperm to find. If it's in bad alignment, we can actually work with your body. We do things called visceral manipulations to mobilize your uterus, mobilize those things so that they're in better alignment. The other thing is you want good blood flow to those organs when you're trying to get pregnant, because you want to create a good environment to foster life. You know, so if we have restricted blood flow to our ovaries or to our uterus, it can make conceiving a little bit more difficult.
Oh my gosh, I had no idea.
So we work hand in hand a lot with people going through IVF and to help support their journey through that.
Once you get pregnant, come see you?
Once you get pregnant, almost the same as you would an OBGYN. I encourage people that have not ever exercised in their lives to come sooner rather than later, because then we can put you on a really safe, supportive exercise program. All these studies have come out showing that women that are active and exercise throughout their pregnancies have healthier pregnancies, have healthier babies. And it's not just at birth, but these babies are healthier, like into adulthood, which I think is insane, right? So if we can see you early on and make sure that we're supporting you throughout your pregnancy, I think that would be ideal.
And it's probably going to help the pregnancy not be so painful as it gets bigger and bigger, right?
Yeah, because we know all the changes that are going to happen to your body throughout pregnancy. So we stay one step ahead of it. So knowing that, you know, your belly's going to start popping out, your posture is going to change, we can really strengthen your posterior chain, which is the whole backside of your body, so that you don't feel so much of a strain when your breasts get bigger and your belly gets bigger and, you know, everything shifts. And then postpartum, we encourage moms to come 1 to 2 weeks after giving birth.
And how often would you be coming?
It depends. If you're in pretty good shape and somebody that doesn't have too many issues, we usually see people once a month, early on in pregnancy. Into that third trimester, we tend to get a little more uncomfortable. So people like to come see us because it feels good. We do some massage, we move your joints, we stretch you out, and we make you exercise. So people leave the sessions usually feeling really, really good. And then we do birth prep as well. So around that 32, 35 weeks, if everything's going well, we shift our focus to prepare your body for delivery. So what we do is make sure that all the bones of your pelvis can move all the ways that they need to move so that the baby can come out well. We do pelvic floor and perineal massage to make sure that those muscles we've been talking about can really lengthen, because for giving birth, they have to stretch 200 times their length. You know,
everything has to stretch.
If they're not very stretchy, then we get tears. And if you get a tear, then that's just more complicated. So usually in that third trimester, we start seeing people once a week until they deliver. And then after they have their babies, we'll see you again once a week, probably for the first few weeks, I would say 6 weeks. And then we like to taper off our visits to be able to support you as you do more things. So if your goal is to run a marathon, we want to be there to support you throughout that journey. If it's just to be able to chase my toddler and have a baby and not pee my pants, then we want to support you to be successful in that.
Got it. Jeez, I see all the things I would have done differently. I'm telling you, if you have not had a baby yet, go see a pelvic floor therapist, because I think that's one of my biggest regrets during pregnancy. All right. So when someone does come to see you though, what is, after they've done, you know, the checkup and everything, you've inspected. Is such a funny
the initial evaluation, we call it.
The evaluation. What would a typical session look like, knowing that everybody's going to have different issues, but what would be something pretty typical?
Yeah. So we almost do a mini reassessment every time someone comes in, just to see where your body's at today and how you're presenting. We'll always ask, you know, do you have any aches and pains, anything you're really concerned with? There's always some soft tissue work, so massage, stretching, that kind of stuff. Exercises, we'll definitely do a lot of exercising. And then
is it the kind of exercising that if I go see my personal trainer in the morning, am I going to have too much of a exercise day if I come see you that afternoon?
No, because we'll know that, right? You'll tell me, I saw my personal trainer and this is going on. So it's something a little bit different. Most of the times the exercises that we're doing are really nuanced. So it's a lot, you mentioned Pilates before. So it's a lot of connecting and your intention behind the movement, not just going through these movements. So if I have you doing a squat, I'm looking at your foot position, I'm checking how you're breathing. So I'm going to tell you, take a big breath in, inhale as you lower into that squat before you come up. Make sure you push your knees out, squeeze your butt, engage your pelvic floor, exhale as you lift. I joke around that it's more mentally than physically physically exhausting initially because you're teaching your body all these new movement patterns.
Yeah.
The wonderful thing is once your body knows those movement patterns, it happens without you thinking.
Yeah, that's great. There's this woman on TikTok. I don't even think I follow her, but she ends up in my feed all the time.
Yeah.
And she's like, usually she's like got this calm, soft voice. And she goes, I want you to stop.
Yeah.
Stop what you're doing. You're going to squeeze your Kegels for 20 seconds. And then you find yourself you're like,
yeah.
She's like, take it. She's like, breathe through it again. And you're like, oh my God, I was holding my breath.
Yeah. So I follow her, and I tell a lot of my patients to follow her, especially people that I know are not going to do their exercises or are doom scrollers. My early postpartum moms that are a lot of times like booby trapped or feeding trapped and they can't do anything else. So I'm like, just whenever she comes up on your feed, run through those exercises. The caution with that is Kegels aren't good for everyone.
Why?
So if, we mentioned having a really tight pelvic floor. If you have a really tight pelvic floor and if you get Kegel happy, you can actually create what we call is a hypertonic pelvic floor. And now those muscles are constantly on and in spasm, and you can make things much worse. So there's these machines, the M-Sella, have you heard of it?
No.
And the Mona Lisa. So there are these chairs that some doctors' offices have on it, and they advertise that you do like 1,000 Kegels in a minute, and you just have to sit there and it works out your pelvic floor without you doing anything.
It's like electric, like muscle stimulation?
Muscle stimulation. And it reminds me of, I don't know, back in the day, they used to have those pads that you can put on your stomach that would just do crunches for you.
I remember those.
So it reminds me of that. And for some people, that could be beneficial. But if you just jump on one of those machines without getting a proper assessment, I've had patients come in like with all kinds of issues that we have to like backtrack off of that. So there's a self-assessment that you can do to find out if you have an overly tight or an overly weak pelvic floor. So first we'll kind of do the tight and then we'll do the weak. So what you'd want to do is you'd get in a comfortable position. Usually we tell people to do this if they have a bathtub and they can recline on their bathtub and have their knees bent and just have their legs resting on the sides of the tub.
So back all the way onto,
relaxed, and then your feet would be on the floor of the tub so that your knees can kind of rest out. If you don't have a tub, you can just kind of prop yourself up in bed against like the headboard or whatever it is. And what you would do is you would insert 2 fingers into your vaginal opening and you would try to squeeze your fingers. What you should feel when you squeeze your fingers, you should feel a squeeze and you should feel your fingers get pulled in towards your head. Right?
Oh.
So
how deep are you going?
So you're putting your fingers like all the way like to, as far as you can. You should feel a squeeze around your fingers and your fingers get pulled in. If you feel nothing, please come see me or another pelvic floor therapist immediately, because that means those muscles are not turning on or you don't know how to turn them on. If you feel like a squeeze, but you don't feel a lift, then you're a little bit weak, but maybe with some practice, you can get yourself to do it. So that's how you test the strength. To find out if you have any tension in your pelvic floor, same position, you would just insert 1 finger and you wouldn't insert it all the way. You'd try to insert it just like past your nail bed or to that first knuckle, and you would press on the opening of your pelvic floor, and you would just feel if anything feels bad or uncomfortable,
like
or if
sore?
It gives you sore or a burny, stinging sensation, something like that superficially. And then, so first you would do that and take note if you feel anything. Then you would insert your finger all the way. And then you want to imagine that your pelvic floor is like a clock, right? So we're working the bottom of the clock. So from 6 to 9, from 3 to 9 is what we're assessing. And you would just kind of press into all those areas around the whole bottom side of the clock to see if anything hurts or feels off or gives you like a kind of like a yucky sensation. If you're feeling that, then there's probably a muscle in there that is too tight, and you'd want to loosen those muscles.
I had no idea. I am in my 40s, and no one has ever explained this to me.
It's sad.
I'm like, I like want to cry. Like what? It's that easy to check?
It's that easy. Yeah.
Wow. Okay.
Yeah. And there's like a little questionnaire that we have of a checklist. If you check off any of these things, then you probably have pelvic floor dysfunction. So peeing your pants is one of them. Painful intercourse is one of them. Constipation. If you're constipated, it could be a sign of pelvic floor dysfunction. If you pee really often, like if you feel like you're always having to pee, that could be a sign of
How about if you can hold it? Like it's like people are impressed that I can hold it really well.
That's not necessarily a dysfunction. It's not ideal because our bladder is a muscle just like our stomach is. So it can get used to holding a lot. So that isn't great. Our voiding frequency for peeing should be anything between every 2 to 5 hours. Anything more frequent than 2 or longer than 5, we're really not doing a service to our body.
Yeah. Okay, that's good to know. We talked about incontinence, diastasis recti, prolapse.
Yes.
Can you explain what that is?
Yes. So prolapse is when the organs on the inside of your body that surround your vaginal opening, so your uterus, your bladder, your rectum, and even your intestines, start pressing down onto your vaginal wall and start coming out of your vaginal wall. So coming out of your body by pressing through your vaginal wall.
Wait, that can happen?
That can happen. Yeah.
Wait. Like the wall, like
so it's almost
like
the wall. Your vaginal wall starts collapsing.
Yeah,
and then the organs press onto it. So they don't rip through your vaginal opening.
They're just pushing it down.
They're just pushing it down. So if you have prolapse, you'll feel. Sometimes people will say they have that sensation of having a full tampon in, or a lot of heaviness or pressure on their pelvic floor.
Yeah.
Also, sometimes like people will try to go to the bathroom and they can't because their rectum is bulging in to their vagina. So it's really not great.
Can that happen early in your life?
Yeah, it can. So it depends. It can be a traumatic event, right? So if you had a traumatic delivery or something like that, it can have prolapse. Also, if you're just somebody that has more elasticity in their tissues, you know how some people just have really good muscle tone and are really tight, and then other people are a little more Gumby. So if you're one of those people that is a little bit more stretchy Gumby, you're more prone to something like prolapse because our organs are suspended by ligaments inside our bodies.
Yeah.
So as we age, everything starts to kind of sag down a little bit. And if we don't have the right support, then those organs can kind of collapse into our vaginal canal.
Wow.
Yeah.
Okay. Yeah. That is good to know.
Right. So if you have prolapse, there's a lot of things we can do to help you. It depends what degree. So they grade your prolapse by how far out of your body the organ is coming. I know.
Oh, wait. So this is when I've heard from friends that are OBGYNs that your vagina can kind of come outside of you, like you can have it like come inside out. Is this what this is?
What this is.
Okay.
Yeah. Sometimes by just teaching you better ways to manage your intra-abdominal pressure. So like when you were doing that squat, when you're picking up the baby, to really pull up and in, that can support the prolapse. There's these things called pessaries. So I like to think of them as a sports bra for your pelvic floor, right? You wouldn't go running not wearing a sports bra, right? So some people need to wear these support garments for your pelvic floor. And there's different types. There's some that you put inside your vagina and they act like a shelf. Okay. So they'll hold up your organs to keep them in place.
Wow.
Yeah.
How do you know that it's maybe starting to happen? Is it pretty obvious to you that it's starting to happen or no?
So there will be symptoms. Yeah. So you would feel pressure, heaviness, kind of like, you know, when you're on a heavy day of your period and you're just like, you feel congested or heavy or down there. So it would be a feeling like that all the time. Sometimes if it's really bad, if you go wipe, you might feel that bulge coming in through the outside or even see it, or that full tampon feeling.
Got it. Okay. That's good to know.
Yeah.
Wow. It's so hard being a woman.
It is. I know.
Is it pregnancy that causes this?
Not necessarily. Pregnancy can contribute to it. But if you have bad habits and you're constantly pushing down on your pelvic floor when you should be pulling up and in, then you can create kind of that issue.
And you guys, I'm telling you, like she keeps saying things and I keep being like, oh, I like keep adjusting myself.
So the funny thing is I keep seeing you, like every time you do it as you breathe in.
Yeah.
So we want to engage our pelvic floor when we breathe out.
Oh, see, I do it wrong. Okay.
Right. And most of us do. So learning to breathe is probably the hardest thing that we'll do. So the way our core works, all those muscles that we talked about in the beginning, the diaphragm, the abdominal muscles, the back muscles, and the pelvic floor muscles, they should all work together in unison, right? So every time we inhale, our rib cage should expand, our diaphragm should relax and our pelvic floor should relax. So on inhale, everything should relax. As we exhale, everything should pick up and in.
Wait, when you're having sex,
Yeah.
you know, like how, like, I'm trying to think about like my teenage mind, like the things we used to say and think about. Like when someone says you're tight, is it because of your pelvic floor, or is it, or like is it a good
like the
thing?
tissue?
Yeah, like what's...
I mean, too tight is bad, right?
Yeah.
So the tightness could either be muscular or it could also be
That you're
your
just-
tissue
yeah.
is tight.
Yeah.
Obviously, if after you've had a vaginal delivery, your tissue is going to have more pliability than somebody that doesn't have, after you've carried a baby, you're also going to have a little bit more stretch on those tissues. And another thing that really takes into account on quality of your tissue is actually your ethnicity.
Oh.
Yeah. White people have more stretch to their tissues. And then I think Hispanics, African American, and then Asian descent actually have the tightest tissue. Yeah. Yeah. So good and bad. So it might have been a really good thing that you had your C-section, because if you're of Asian descent, you're at a much higher risk for vaginal tearing through vaginal deliveries.
So how does our pelvic floor affect us in menopause?
Those muscles that need to be strong to support those organs. If they're not strong, you're more likely to have all the bad things associated with menopause, right?
Like the UTIs, all that stuff.
The dryness, the painful sex, the increased incontinence. Even our bone density goes down. Yeah. So imagine if you are not going to go do a HIIT workout class because you'll pee your pants. Then you're more likely to have weak bones. And then, I'm obviously exaggerating things, but if you stop exercising in your 40s, that high impact type of exercise, because you're scared you're going to pee your pants, then you're more likely to have bone loss when you're 80. And more likely to fracture a hip.
Before we wrap this up, are there things that people should be aware of, like as we sit, like I'm sitting cross-legged, for instance, like are there little tips that you can leave us with that we should, before we even like go get an exam? Yeah.
So sitting cross-legged gets a bad rap. I do it all the time too. It's not terrible. I think you shouldn't just in case pee. So if we're leaving the house, but I don't have to pee, but I'm going to go just in case because I don't know how bad the traffic is going to be, that is something that can create havoc on your pelvic floor. So we shouldn't just in case pee. The other thing that
Wait, can I ask why?
Having to pee is a loop system in our brain, right? So the more often we pee, the more often we're going to send the signal to our brain that we have to pee. So then we're going to have to pee more often. So you don't want to just in case pee because it creates that bad loop and habit in your brain. The other thing is, like, if you're one of those people that every time you turn on the water, it gives you that sensation that you have to pee. So if that happens to you, you shouldn't run to the bathroom. You should try to suppress the urge as much as you can.
For how long though? Because you were saying like between 2 to 5 hours.
2 to 5 hours.
Okay.
Yeah. So if it's been 3 hours and you haven't peed and you're leaving the house and you feel like you have to pee, go pee.
I'm just pretty damn good on an airplane. And people are impressed about this. Usually if it's like a 4 or 5 hour flight, I'm good. But if it's longer than that, then obviously I'll go use the restroom.
Airplanes, public restrooms, we all tend to hover.
Yeah.
And we don't like to sit down. That is really, really bad for our pelvic floors, because in order to fully empty your bladder, your pelvic floor muscles need to fully relax, because there's like, if you think of like the tube that lets pee come out your urethra, comes out of your body, it's surrounded by muscles. So if we have those muscles on, we might have to like push or something to get all the pee out. And then we can actually damage those muscles, though they can't contract as hard. I'm guilty of it. I've done it. I mean, especially when I was younger and I'd be out in a club somewhere.
She's like, you don't want to say club.
Yeah, in a club, wherever, you're not sitting on that toilet. But as much as you can, try to like line it, have a seat, relax and pee.
But what's the difference? You know how some cultures, they actually like squat over a hole?
Yeah.
Right? I mean, are they going their whole lives like ruining their pelvic? Oh, because they're actually doing
in a full squat. So your knees are higher than your hips. And when you're in that position, it actually is, we should all be peeing like that and pooping like that. That's why the squatty potty. Have you heard of the squatty potty?
Yeah, that was a gift from my producer, Anna. It was the best thing ever.
So the squatty potty is the best thing ever because it puts you in that position where your muscles and your bones and everything are in the ideal alignment for everything to exit the way that they should.
Okay. Yeah. All right. That's good to know. Other tips? Any other tips?
Don't clench your jaw.
Wait, how does that affect our pelvis?
So our jaw and our pelvic floor muscles are besties. They actually embryologically, so when we were fetuses, they originate from the same thing. Just for a lack of a better explanation. Typically, if we clench our jaws, we're clenching our pelvic floor. So people that tend to have TMJ or jaw issues most likely have pelvic floor
And now
issues.
I'm going to be like judging all my girlfriends that like post on social media, like getting my TMJ, like their Botox or like doing the masseter stuff.
Pelvic floor therapist too.
Exactly. I'm going to be like, girl, you're tight.
Yeah. So usually our jaw and our pelvic floors are very connected.
Okay. Good to know. How about any like exercises at home, or don't do anything until you've gotten an exam?
It depends what's going on. If you're having pain with intercourse or you're having any kind of pain in your pelvic area, I wouldn't necessarily start a Kegel routine. If it's something about diastasis, right? What exercises are good are those deep core exercises. So crunches aren't necessarily bad, but they're not going to strengthen what you want to strengthen.
Okay.
If you have diastasis and you notice like a big bulge or like a hole in the middle of your stomach when you're doing exercises, that's probably not the most appropriate exercise for you. So there's no bad exercise. It's really specific to the person and making sure that you're doing an exercise that's challenging you appropriately. But yeah, if you see a bulge or a dome, or you feel it in your back or your hip flexors and it's supposed to be an ab exercise, just take a break, regroup, and try something easier.
Okay. What do you think about people getting, like if they have diastasis recti, getting a tummy tuck, or we were talking about this, a plastic surgeon has told me that he can go through my C-section incision, go up and just suture those little bit of muscles that I have, that little separation. If you guys don't know, diastasis recti is when your ab muscles kind of like separate instead of going right back together.
Right.
Do you think that it would be helpful for my pelvic floor to have that sutured, or is that maybe worse to get surgery?
Yeah, that's such a good question. So the best outcomes I've seen from diastasis surgeries are the people that prehab before. Because kind of backtracking to what diastasis is. So diastasis is that separation of your abdominal muscles, right? They can separate and there can still be connective tissue attaching the two parts. If you still have connective tissue that's like connecting this side to this side, we can do a lot to strengthen you to bring it together. But if your diastasis was so bad that there is nothing left in between these muscles, we can strengthen the heck out of you. We can do everything, but there's no way we can bring those together because there's nothing to pull them together. So those are the people that need surgery. So for people like that, usually they'll send you to therapy first, make sure that you're doing all the things properly, that you're engaging your core and pelvic floor together. Then they do the surgery. And I've seen amazing outcomes. Not only like aesthetically is where you want it to be, but also functionally, everything feels stronger and more secure. On the flip side of it, I've had people that have just done the surgery without the rehab, and then they end up with prolapse or they end up with incontinence because they're not managing that intra-abdominal pressure well, and they're constantly pushing down on their pelvic floor.
Okay, so it goes hand in hand.
Yeah.
Okay. How about if you didn't do like a prehab because you just didn't know?
Yeah, you can always do it after.
Okay.
Yeah, you can always do it
after you've had the tummy tuck.
Yeah.
Okay, that's good to know. This has been so insightful. I bet we're going to have a ton of questions, but it absolutely got my mind going. Like just thinking about all the things I could be doing, and definitely I need to like book an appointment ASAP.
Yes, for sure. I would love to see you.
Yeah, I would love it too. So tell everybody where they can find you.
Yeah, absolutely. So we have 2 offices in Miami. We have one in Coral Gables and one in Midtown. We're on Instagram at Freya Wellness Co _. So you can find us there. We also do virtual appointments. So if you're not in Miami, you can reach out to us and we can see you virtually. And also all us pelvic floor therapists tend to know each other. So if we really feel like you need some hands-on, we can send you to somebody that we know and trust in your area.
Thank you so much. I'm telling you, I'm going to leave here being like, okay, all the things that we're going to do. So thank you. This was insightful.
Yeah. Thanks for having me.
Thanks for tuning into this episode of GlowLab. If you enjoyed it, make sure to leave a review, share it with your friends, give it a like on social media. And it's all so we can continue giving you really great episodes and bring you on some really great guests.